I'm Andres Martin. I'm a child psychiatrist practicing in New Haven, Connecticut at the Yale Child Study Center. Like anyone, I could identify myself with in many ways, but I want to put right off the bat two that I think could be very relevant to our members, younger members. One is that I'm Mexican. I was born in Mexico, and I identify myself as Mexican American. I think that by now I've lived a little bit more than half of my life here in the States, but the other half in Mexico, and Spanish is my native first language. And the other thing related to it is that I am an IMG. I am an international medical graduate. All of my medical school was in Mexico. So those identities, I think, are important. Maybe a third important, speaking of that might be relevant, is that I'll make a confession to you here, Brandon, and that is that I failed the boards twice. So I think that that's part of my identity. A former flunky who went on to do okay, and I think that that's important for people to know. I think that there are two big things. One is my love of the humanities and my hatred of blood. I'll come back to that. And the other is family history. So let me start with the family history. Just briefly, I come from a psychiatric heavy stock. For me, this is not theoretical. For me, this is very real. And from a very early age, I was exposed to serious psychopathology as a child throughout my growth. So that I think is the thing that set me off, set me on this path. The second thing, my love of words, is that I've always been interested in the humanities and literature, philosophy, but that seemed very theoretical, not practical. I come from a very practical family. I don't like blood at all. There's that old chestnut. What is a psychiatrist? A nice Jewish doctor who's afraid of blood. I don't like blood. So I tolerated medical school. I actually loved it, except the bloody parts. But I knew going into medicine that I was going to do psychiatry because it felt to me, and maybe this is a bumper sticker, psychiatry felt to me like applied humanities. And it was a naive and romantic thought at the time, but 30 years into practice, it seems to fit. I think that that's in great part what psychiatry is, applied humanities. So there are two. The first one, of course, is the American Academy. I really fell in love with child psychiatry, which was not plan A, when I went to the Academy at a meeting in Washington, D.C. 30 years ago or something like that. And I haven't stopped going ever since. It's been a very rich intellectual, social, academic home. So that is the main one. I should say with great pride that I haven't missed any meetings since that first one that I went to. The second one is YACAPUP, the International Association for Child and Adolescent Psychiatry and Allied Professions. It's a mouthful. That is one of the international organizations that I've been affiliated with and active with for the past 20 plus years. The other ones, APA and others, I may have gone once or twice, but they never felt right. So the first thing in terms of the organization as a whole, I would say that ACAP is of the perfect size, meaning that it's large enough that you can find everything and anything, but small enough that it's very intimate and you can establish very meaningful relationships that span years and decades. In terms of my activities at ACAP, I have done many things. I'll highlight, well, first I've presented. I've gotten the willies, the nervousness out of presenting largely through my work at ACAP, learn how to do that, whether it's a talk, a poster, etc. I have socialized. I have built wonderful relationships. And in more formal positions, I think that there are three worth noting. The first one is actually not formal, but I think that there's a big message in there. I was I have never been a formal standing member of the MSR, the Medical Student and Residency Committee. Never. And yet, I was very involved in establishing many years ago the mentorship program that continues to this day. I mention this because oftentimes we feel that unless we are in some committee, we can't do anything. And it's a very important message to say that you can do anything. And the committees are, it's nice. It's nice to be involved, but you don't have to be a card-carrying member. You can just, get involved. So that's an example that I'm very proud of, because I see years later the revenue, the return of investment of that. And it's an apt analogy, return on investment, because the first time we did it in Toronto, actually, the mentorship group, I think that there were 10 people. And by now, I've lost count, but it's in the hundreds. So that's been very special. And the second and perhaps the most important position that I've had in the academy that I'm really very privileged and grateful for is that I was the editor of JCAP for a decade, 2018 to 2017. That was a thrilling time. It was just terrific. And I would say that more than impact factor or glitziness of the journal, when I look back, the things that give me the most pleasure now is to see how many of the people who have continued in the journal started as residents and as, young people when I started. The current editor, Doug Novins, was not a little guy. We're about the same age. But he was part of the editorial board. And to see him now as editor-in-chief is amazing. And it's also amazing, I should say, that he has leapfrogged over me. He has done so many more wonderful things, and that's an important thing, to feel joy and pride in your successors doing better than you. The last thing is that I was secretary of the academy for 2 years, but I think that's, I don't know, less exciting in some ways than the academy or the mentorship. That's always a hard question for me, because at the same time there's a ton and there's zero. And that has to do, I think, with the fact that I've largely done inpatient child psychiatry throughout my career. So the amount of anecdotes per day is extraordinary. But the way to really thrive, not survive, but thrive in an inpatient unit, I've been doing it for 20 years, is in some ways leaving work at work. Yeah. So in some ways I have a terrible memory for patients' names, for patients' details, because once I'm gone and once they leave, I need to move on. Otherwise, with the kind of, not just anecdotes, but the kind of trauma, the kind of stories that I hear on a daily basis, I would be submerged in vicarious trauma. It's a wonderful profession. It's a very enriching profession. Enriching, not enriches. If you want to become a gazillionaire, don't come into child psychiatry. But it's a very meaningful career, profession. And although it can be very hard at times to see and hear the things that we do, I'm always buoyed and encouraged by seeing so many kids get better, and for us, not to cure, we do that once in a while, but to change their developmental trajectory for the better, even if it's 1 or 2 degrees. And that happens all the time. And when you think of 2 degrees of developmental trajectory improvement over time, the compounded interest of that becomes way more than 2%. So getting there early, bringing ourselves in our full wholeness can make a big difference. Sometimes medication helps, by the way, but I like to say, and I think so, I believe so, I live so, we are the medication. Yes, both. As a Mexican American, as a Spanish-speaking psychiatrist, it was and it is a wonderful skill to speak Spanish fluently and to be able to connect with families at that level. I was personally, I've been personally fortunate that I haven't been the target of anti-Mexican, anti-Brown, anti-Hispanic sentiment. I think that the worst that I have experienced, which is really not nice, but in the scale of things, I've been multiple times been told, you don't look Mexican, and what to do with that. But that's as far as personal attacks, if you will. So there's been many advantages in the language and the nationality, and for me personally, few disadvantages, although I know that for some of my colleagues that has not always been the case, that there is degree of discrimination, of racism, etc. In terms of the IMG aspect, I think that has been more interesting in the sense that, yes, it was, I believe, harder to get into places, into programs, into things. When you look back 30 years later, there's no difference, right? But at that time, it was quite difficult. And I think that for those who are not IMGs, it can be hard to understand that there's I don't know if a acculturation or something stressor about coming to this country, of not knowing how medicine is practiced here. Totally different. Of having to relearn, maybe not the books, but the practicalities. And that took a long time. And the result of that is second-guessing yourself, not feeling fully yourself, etc. So I think that those two might be relevant to our discussion. Yes, so if I were to name the secret sauce, the first one, of course, is family, family, family. I've been very blessed with the family that I have and the supports that I have, especially moving from another country and, coming on my own. So the family that I've created here has been the most important of those. Mentors are absolutely key, critical, and I've had a range of mentors throughout my career, and I continue building those mentorship relationships. And I've been very clear to myself that it's not one mentor that you need. You need as many as you can get. You need a multidisciplinary team of mentors. And I think two more things about mentorship. One is that mentorship does not end when the mentor leaves or dies. And I've learned that now several times, because you end up internalizing a lot of the mentor. It becomes almost like the proverbial little cartoon telling you things and you don't know what to do. So that's one really neat aspect of mentorship. I mean, it's very painful to lose a mentor, but this is a way of moving it forward to say that lives end, but meaningful relationships do not. And the second thing of mentorship, now looking back on a longish career, is that you start paying it forward. So that just as I've been mentored, and I'm so grateful, by more senior people, now I've mentored younger people. But the real neat thing is that those younger people have mentored me, and that we get into this bilateral rather than paternalistic hierarchical relationship, and that is fantastic. I would say, again, taking a long view, that one of the things that I've liked the most, and this is really important, I think, for people considering or early in the field, I really love the fact that I've changed over time, the things that are my favorite. There have been some stable elements. I've always been a clinician, most of that time inpatient clinician, and I love that. I absolutely love that. And there are times when that has been the most special thing, but it's always up there at a 9 out of 10 or whatever at a very high level. But there's always been something that sticks its head out and goes to a 10, and that typically lasts a couple of years. So, for example, the journal was one of those. I was very ignorant in statistics and methodology. So 20 years ago, I got a degree in public health, which was incredibly exciting and led to all sorts of things. And now I recently got a PhD in medical education. So if you ask me what's most exciting to me these days, it has to do with medical education, and I could go on and on about that. But of course, trying to combine medical education, which is a whole huge science and field, together with child and adolescent psychiatry, that is something that these years gives me a lot of joy. But the flexibility or the changeability, the fact that there are many different things that you can do, that you're not married to one single thing forevermore. And that it doesn't mean the fact that I love medical education doesn't mean that I don't love inpatient work or clinical work. I do. But, things change over time. There's some constants and there's some change. Well, I would just and sorry if I sound pedantic here, but I think it's an important point in our field. I would distinguish medical education and education from training, because often they get conflated, in particular in our field, where emphasis on education. And what I mean by education is best practices, novel, innovative approaches based on pedagogy and science. There's very little of that. But I think that your question is perhaps more relevant to training. Training can be tough. Training is tough, almost by definition. And how to weather that, how to not just survive fellowship, but to thrive, to live, to enjoy it. And it's hard to make big generalizations because there's so much difference between different sites, right? So it's hard to control for that. But the key elements that may be universal are: find yourself a mentor. Don't wait for a mentor to find you. I think that every child psychiatry trainee, or everybody, could benefit from therapy. Not because we're screwed up necessarily, some of us are, but because there's a lot that we deal with, and that having that support can be very helpful. So I would say that that's something that I would encourage people to consider, and certainly push back if, God forbid, a program says you can't go because you need to be seeing your 100th patient. This is the kind of things where release time is very, very important. To be an active learner, of course, to have an inquisitive, active learning mind rather than expecting for things to be fed back. And to find joy in the work, to find joy in the service. This is a career, a life of service, and in being able to accept that, enjoy that, remind oneself of that. So those may be the variables where one can have a little bit more control. But then, of course, there are the variables that one has very little control of. And there's the reality for all medical specialties. Medicine is broken in many ways. Case example number one, electronic medical record. I mean, we could go on and on. There are all these externalities that are very difficult and that I don't have an answer for. First little anecdote. My kids make fun of me all the time. They say, "You're so dumb you didn't even go to college." And they're right. I didn't go to college because in Mexico you go from high school into medical school. So I didn't go to college. Yeah, where there's sentinel events, if you will, or fulcrum points where things really change. I don't think it was towards medicine. I think that was already said very early on. I don't think it was towards medicine, towards psychiatry. That was already very set on. But there definitely was a fulcrum point, a point of inflection from psychiatry into child psychiatry, which was not the original plan. And there were two things that really led to that big change that has been a sustained one. One was meeting the right person. My first and most important mentor, Donald Cohen. I met him at a meeting. We talked, and that really made a huge impact. And the second one was the academy. I went to an academy meeting in Washington 20 plus years ago, dragged by one of my residency mates. I had no interest in child psychiatry. And I came back saying, I kind of like this. And I like these people. Because remember, you're marrying yourself not just to the kind of clinical work you're going to do, but to the colleagues you're going to be surrounded by. And I have to say that there's no colleagues, I would say, as nice and supportive and kind as a group as child psychiatrists. I'm sure that there's some, pieces of work, but most are really kind people. I mean, you need to be kind to work with kids and to work with mental health and to, medicine forces you by just how intensive it is and medical training by unvirtue of how difficult and exacting it is. It forces all of us to put aside pieces of ourselves that are important to ourselves. So, in those pieces of ourselves are sometimes never returned to, and they just go away. But piece of advice one would be nurture that piece of yourself. Maybe you can't be a ballerina for 10 hours every day, 5 days a week like you were in high school, but find a way of keeping that alive. Maybe you can go to a hip hop class, I don't know, once a week. By the way, I know nothing about dance. I'm just picking that example. But you want to do what's called nurturing your shadow. And this idea of the shadow is a term from Carl Jung, who said we all have our shadow selves, that part of ourselves that we forget. So that would be one. And you're going to have to remind me what the question was. I got a little.
Yeah, the question
How
is,
to marry? How to
how do you blend your creative aspects? I mean, and how do you just join in and
Yeah.
do things like writing or anything like that?
Yeah. Yeah. So in addition to nurturing your shadow, being pushy, but not so pushy as to having gall. So what do I mean by that? If you like writing academically, reach out to the people in charge, those journals. Find out how you can contribute. I like to say, and it's true, that I became editor of the journal by writing book reviews. I wrote book reviews because I like reading, and I, wrote. It forced me to think. And after some years, I became the book review editor, and then I became the editor-in-chief. So, that's my trajectory. But the point being that keeping writing active was very important. That was my kind of writing. But there are many kinds of writings. Not everybody needs to go in an academic writing direction. Whatever it is, once again, that you like, that shadow, that part of yourself that you have not nurtured and put aside, make it a point very intentionally to return to it. And don't feel that you are being a poser for going to 1 hour of hip hop class a week rather than dancing like a ballerina for 10 hours every day. Know that it's what you're doing to keep the flame alive, and that flame will come and go. And importantly, that flame may totally change. That ballerina might not end up dancing at Carnegie Hall, but something can and likely will come out of it. Perhaps completely unrelated to dance. We don't know where we're going. Maybe I should say this, even though we're developmentalists, or perhaps because we're developmentalists, um, it's very hard to predict the future, as Yogi Berra would say. So we have very small predictive power on who we are going to be 5 and 10 and 15 years from now. And that is not to mean a depressive statement that we can't predict anything. It's actually an exciting statement to say, open yourself, allow yourself to what life will bring. The opportunities are there, and especially in child psychiatry, the field is completely full of opportunities. We have had a movement certainly during my time in practice, from this consulting room, therapy room, to modes that are more population-based relevant. I think we have a whole lot of room to go. The pandemic, awful as it was, and I like to use it in the past tense, it opened important avenues for us, including Zoom, like we're talking about now. I want to think that, I don't know, 5 years, some years from now, we're going to look back on Zoom and say, oh, remember how quaint that was? Because some new technology will have been developed to help us get to more people more quickly, more efficiently. There's speculation in TV and elsewhere that that future could be very dark, with all of us having brain chips and Big Brother taking control over us. But I actually think that technology over the centuries, millennia, has been much more productive than sinister. We don't know really where this is going, but I think certainly a large-scale population-based approach is where we need to go. And I don't think it's all going to be about genetic chips that will have your profile for which you put a molecule, although that may be one important component. And I don't think it's necessarily having avatars giving you psychotherapy, although that may be an important component. So I don't know. I'm hopeful. It's a very naive notion, but I am hopeful that we will be able to make some illnesses disappear. And I don't think that's entirely naive. We were able to make the leading cause of psychosis go away, which was syphilis. Who would have thunk, right? So I don't know. I'm a perennial optimist. Join us. We need you. We really need you. You're never going to be out of a job.